Are you able to see it?
Yes, we can.
Okay, perfect. Great. Well, thank you so much for that warm welcome. As Dr. Jim mentioned, my name is Ria Ghai. I am very honored to have the opportunity to speak with you all today. So I'm trained as a disease ecologist, and now I work as an epidemiologist in CDC's One Health office. And before I begin, I'd like to acknowledge the Muskogee and Cherokee Nations, the traditional landowners of where I'm joining today and where the CDC Atlanta's campus now sits. So today I'd like to speak to you about One Health, which is an approach that's not new, but it has gained traction in recent years. And so first you might be wondering, what is One Health? So what I'm showing you here is actually the official US government definition for One Health, and it was developed as well as adopted in 2019. It's a bit of a long definition. So to paraphrase, One Health is basically an approach that recognizes the fundamental interconnectedness between people, animals, and plants, as well as our shared environment. And using a One Health approach means cross-cutting silos to implement methods that optimize resources and benefit not just people, not just animals, but ideally people, animals, and our environment as well. So perhaps the flagship threat of One Health is zoonotic diseases, which are able to spread between people and animals. And we've all heard of some of these: rabies, anthrax, COVID-19, avian and swine influenza, and many others. But the problem with zoonoses is they don't respect species boundaries, and many can easily cross between people and animals. But in most countries, including the US, our health infrastructure is siloed. So we have public health agencies like CDC, we've got agriculture and livestock agencies like USDA, and then we have wildlife agencies. And when it comes to zoonotic diseases, using a One Health approach basically allows these different organizations to coordinate, which can help optimize resources. And this is becoming increasingly important because we know we're interacting more closely than ever with animals of all types. And both people and animals are moving around the world at unprecedented rates and frequencies. So that means that these diseases can be introduced and spread more rapidly in the past. So while zoonotic diseases might be One Health's kind of flagship stance, One Health is more than just zoonotic diseases. So with respect to the health of our tribal and indigenous populations, an important One Health issue that we recognize is food safety and security, for example. So we want to make sure that people can hunt, forage, and prepare foods that are important for their traditions and cultures in a manner that also keeps them safe. Similarly, the One Health approach recognizes that natural environments are more than just another landscape. They're a place of worship, they improve our mental health, and they have inherent value that requires their preservation. So those are just a few of the other One Health issues. And before I talk a little bit more about the work that my office does, I want to provide an example that might help contextualize the use of a One Health approach, because I know when I first encountered it, it seemed a little amorphous and difficult to grasp. So this is not a study that CDC was involved with, but I thought it was a really nice example. And it was conducted in the Indigenous Sahtu communities in the Canadian Northwest Territories. And this is a location where there was actually long-term veterinary services programs that were being run. And the article that I'm showing on the screen describes the use of a One Health approach to understand changes to both canine and human health in the relation to those veterinary services. And overall, the authors found that over the course of a decade, the proportion of dogs that had received preventive veterinary care had been sterilized, and the median age for dogs overall was increasing, which is good news. In addition, the attitudes of the community members had also changed during the study period of 2008 to 2017. So dogs were more favorably considered overall, with greater breadth of perceived value. And there was also a considerable decrease in the fear people had of dogs, which the authors thought might contribute to overall community welfare. So I think this is a nice example that highlights how One Health can benefit both people and animals, and that measuring the actual use of these types of One Health programs can really meaningfully inform future interventions that both hear and adapt to community voices. So now I'd like to switch over to tell you a little bit more about CDC's role in One Health. So from the US government perspective, having a One Health office in key agencies is really important to ensure that there's a dedicated contact to coordinate One Health issues within the agency and with other partners, both in the US and around the world. CDC was actually the first agency, the first federal agency to establish a dedicated One Health office, which happened in 2009. Our office works in the US as well as around the world with the mission of overall protecting the health of humans, animals, plants, and our shared environment. I'm sure you all are noticing a theme here now. And a large part of what we do is coordinate and collaborate with One Health partners. So we have liaisons with other federal agencies, including USDA, as well as international organizations like the Food and Agriculture Organization of the United Nations and the World Organization for Animal Health. We also provide scientific expertise on how the One Health approach works, how it can be applied in various contexts, and how it can and is successful. So I won't dwell on this slide too much, but it does kind of help identify some of our top priorities in protecting global health, preparing for pandemics, conducting surveillance, developing strategies and policies for One Health, and readying for emergencies like hurricanes, fires, disease events, things that affect people, animals, and environments. And so building on that last point, when CDC is faced with a health emergency, we actually activate an emergency response structure. It's based on the incident command system. And through this structure, we can localize in a physical space. That's what I'm showing you on that picture, which is the Emergency Operations Center. And the emergency response can actually pull in groups of experts like us in One Health to assist with specific issues. So during environmental events like hurricanes and floods and wildfires, we can work with local governments and welfare organizations to assist with One Health needs. So, for example, if people are evacuated from an area due to an environmental event, they're often required to leave their companion animals behind, and that can cause distress for owners and pose an animal welfare issue. So we try and help mitigate those impacts by developing plans and protocols that include animals. We've also been involved in infectious disease emergencies like COVID-19 and Mpox, and I will talk more about COVID-19 near the end of this presentation. So before I go into that topic, I'd like to share a few of the activities my office regularly engages with, and hopefully we'll have time for a bit of a discussion at the end, how we can engage with tribal and indigenous voices a bit further afterwards. So I wanted to start with one of our primary global activities, which we began conducting in 2014. It's called the One Health Zoonotic Disease Prioritization Process. And the overall idea is to bring together representatives from human, animal, and environmental health sectors and prioritize a short list of zoonotic diseases in a locality. And these localities are typically countries, but we've actually seen prioritizations occur in regions, in states, and other geographic areas. But the process itself uses both qualitative and quantitative methods to incorporate the most important part of this, which is equal input from all represented sectors. It allows for local adaptation, and it's been used to inform assessments, planning efforts, strategies, etc. And create basically and strengthen One Health coordination, laboratory capacity, outbreak response, prevention and control strategies, and to improve the workforce. So here's a map of where we've actually conducted these OHCDP workshops in the past. So at the request and invitation of a host government, our office will collaborate with partners. And in the past, we've already conducted 43 of these workshops from 2014 to present day. The ones in green are countries. The ones that are outlined in blue are regions, and the ones in purple are subnational workshops. You might notice that on that map, the United States was green. So I'd actually like to focus on the OHCDP that was conducted on our own soil, which happened in 2017. So this workshop was actually jointly led by 3 federal agencies, CDC, USDA, and DOI. And all of our OHCDP workshops are actually published online. So you can go and read the workshop report if you're interested, but I'll paraphrase it for you here and give you some of the major outcomes. So the first outcome of an OHCDP is what I talked about before, that initial list of priority diseases. So these should be the diseases that the jurisdiction or locality thinks are most important for coordinating and One Health action. So they're not the ones that are important necessarily for any one sector. They're the ones that are most important for One Health action. And this list is usually between 5 and 10 zoonotic diseases, depending on the capacity of the locality. And in the US, you can see here there was 8 zoonotic diseases that were prioritized. And you can note that emerging coronaviruses was listed at number 5. And this is 2 years before COVID ever emerged. So since this time, the federal agencies that were involved in the OHCDP have been working to improve this kind of joint capacity to control these zoonoses. The other notable output were areas for improved One Health collaboration and coordination in the United States. So I'm going to come back to number 2 and 3 momentarily, which were to create a federal coordination mechanism at the federal level and to develop a framework for One Health. But before I actually go back to these, I wanted to also mention that following that national level OHCDP, Alaska was actually the first state and the first in the Arctic region to conduct an OHCDP that was really brought on by many of their unique One Health issues. And I was really fortunate to be at this workshop and really delighted by the strong presence of tribal health representatives there, including the Alaska Native Tribal Health Consortium. And like the US OHCDP report, you can read about Alaska's on our One Health webpage, but I'm showing here the list of priority zoonoses. And you might notice that first disease on the list is actually not a zoonotic disease per se. However, representatives from all One Health sectors agreed and felt strongly that given the rising prevalence of amnestic shellfish poisoning and paralytic shellfish poisoning in Alaska, those should be prioritized. And that gives credence to the ownership and flexibility we try to make inherent in this process. Okay, so with that little transgression, I'd like to take us back to the federal level. So we finished our national OHCDP in 2017. Admittedly, we were a little derailed on progress resulting from the pandemic that struck a few years later. But we were really delighted when in 2021, through the Omnibus Appropriations Bill, and then again in 2023 through the Consolidated Appropriations Act, Congress actually asked CDC to coordinate with USDA and DOI, as well as federal partners, to do two things: to develop a national One Health framework and establish a One Health federal interagency coordination mechanism. Those were directly in line with outputs from the OHCDP. So we've been busy working on those, and I'd like to tell you just a little bit more about them. So we've now developed a One Health framework to address zoonotic diseases and advance public health preparedness in the United States. We call that the NOF zoonoses for short. So this is a strategy document that guides zoonotic disease prevention, control, response across the federal government. We've also developed that coordination mechanism that they were asking for. We call it the U.S. One Health Coordination Unit, or OCU for short. So this is the mechanism that we'll actually use to implement the strategy outlined in that federally or congressionally mandated document. The NOF zoonoses has actually been cleared through the federal agencies, and we've begun sensitizing other partners and offering opportunity to hear about the proposed activities in the document. So in June, we actually held a tribal listening session, and we invited American Indian and Alaska Native tribes and tribal organization to hear about the activities and potentially give some feedback. For those of you that may have been able to attend that session, we're so grateful to have had your input and are working to incorporate it. If you weren't able to attend or were not aware of that, it isn't too late. We actually expect the National One Health Framework to be published on the Federal Register in mid-September. And at that time, it's going to be available for public comment. So we absolutely would want and value your feedback through that comment period if you do have any for us. And before I move on, I want to mention some other domestic coordination that we already have in place that is going to be subsumed by these newly proposed frameworks. But in particular, we have federal One Health partners, and that includes CDC, FDA, USDA, and DOI that meet monthly with state, tribal, local, and territorial partners to discuss One Health issues and share information. So if you are part of a tribal government health organization, and you've not heard about these calls, but you're interested, we would love to have you join. And you can do that by emailing onehealth@cdc.gov. Okay, so now I'm going to switch gears a little bit because we've talked a lot about CDC's role in One Health from a policy and strategy standpoint. But we also offer a lot of technical guidance. And so I wanted to speak a little bit about that now. So our latest and greatest technical guidance is what we're showing here. So we had actually been hearing from a lot of countries that operationalizing One Health can be difficult and highly contextual. So what we did was we tried to publish some general guidance that we're calling the Generalized One Health Framework for how countries or jurisdictions can essentially help starting to control zoonotic diseases. So this framework has 5 steps and associated actions that are intended to try and help build One Health capacity to prevent and control zoonoses. And it includes a toolkit as well as some examples from a few commonly prioritized zoonoses like anthrax, brucellosis, rabies, etc. So I'll talk a little bit more about what the GOF actually is. So we did write it and intend it for use by government officials that are managing zoonotic disease programs. So like rabies, anthrax, some of the other ones that I mentioned. And the guidance we present was developed by subject matter experts. And what we asked them to do was essentially combine some successful real-world examples with idealized approaches. And I'll quickly go through some of the components of the generalized One Health framework so that you can see kind of what's at your disposal if you ever need this information. So this is the overall GOF framework. So it's really meant to develop or improve capacity for any given zoonotic disease through the use of a zoonotic disease program. So the dark teal circles are 5 steps, and the light boxes are corresponding activities for each step. So our steps are engagement, assessment, planning, implementation, and then monitoring and evaluation. And under each are a set of recommended activities, which all have guidance associated with them in the actual document. And these steps and activities, they're not meant to be prescriptive, but they are meant to provide guidance at any place a user might need it. The GOF also comes with a toolkit. So this is a list of guidance, resources, tools. They're not exhaustive, but they can help a user both understand what's being asked by the activity, assess where they're at currently, develop action plans, and build capacity through the use of already developed tools that were intended for that purpose. And we've done the work already of matching those tools to the steps in the GOF so they're easily accessible. Finally, we provide One Health capacity building recommendations in this guidance for several technical domains that we've listed here. So we give examples of successful One Health approaches in each domain. So under laboratory, for example, we talk about the Canadian Science Centre for Human and Animal Health, which houses level 4 containment labs for both human and animal diagnostic research. And resulting from that kind of collaboration between the diagnostic labs, this was associated with the breakthroughs for Ebola vaccine. Under workforce, as another example, we talk about programs like the Field Epidemiology Training Program, which trains medical doctors, epidemiologists, nurses, veterinarians all together to show the value of a diversified One Health workforce. Here, though, I'd like to focus a little bit more on surveillance and joint outbreak investigation, because here we actually developed examples of what surveillance that uses a One Health approach can really look like. And I'd like to show that to you next. So we actually met with subject matter experts throughout CDC on a number of zoonotic diseases, and we developed these event-based surveillance visualizations. So what you're seeing here is our example for rabies. And what it shows is a human health sector on top, and then the animal health sector on the bottom. And moving from left to right are the actions that would occur on the ground first at the local level, and then propagating up to the community, the subnational, national, and international levels. And we show what would happen in each sector. So the individual swim lanes here, as we like to call them, as well as what happens on the midline, which are your One Health activities. So these One Health activities we highlight in teal to make them a little bit more obvious. So as you can see here, for rabies, events are triggered by either a person getting bitten or presenting to a health facility, which we hope doesn't happen with suspected rabies, or by an animal being captured and monitored for suspected rabies in the animal health sector. No matter how the event starts, though, it triggers a joint investigation, lab confirmation of the sample, ideally at a shared lab, and information sharing at the higher levels. So let's take a look now that we're a little bit more oriented at one more example. So this is for zoonotic influenza, and you might just notice right off the bat that it looks quite similar. So cases are detected when there are swine or poultry mortalities, and patients with no contact with livestock report to health facilities. On the zoonotic disease, as the zoonotic disease response moves out of the community, however, the actual surveillance infrastructure looks quite similar to rabies, and actually it looked quite similar no matter which zoonotic disease we mapped this for. So because all of these zoonotic diseases looked similar, we were able to use these examples to make some generalizations. So overall, we know every single zoonotic disease is really quite different in their traits, in their epidemiologic approach required to detect them, in their diagnostics. But the actual surveillance approach is quite similar, especially at those higher jurisdictional levels. And so this is especially true of the One Health aspects associated with tackling a zoonotic disease. It almost doesn't matter what it is. Those pieces are typically similar. They're joint outbreak investigations, their information sharing, their joint reporting, and their multi-sectoral technical working groups. Those are the things that are similar, no matter the zoonotic disease, no matter the event. So these visualizations were really popular as part of the guidance. They were actually definitely the most popular part. And we've actually received dozens of requests from countries to be able to depict their own surveillance infrastructure. And we've actually listened to those requests, and we're in the process of creating a web portal, which we call the One Health Surveillance Visualization Tool. And this is going to allow users to depict their own surveillance infrastructure that they have both within their sector, as well as those One Health connections that they have with other sectors. So this tool is currently in development, but we hope to have a release available early next year, and this will be freely available for public use. All right, so the last thing that I wanted to talk about today was the real world example of One Health during the COVID-19 pandemic. So as we all know, COVID-19 made history for a number of reasons, but for CDC, one of the things that was really quite unique was we were asked right at the beginning of the event, before the virus even had a name, if we could set up a One Health group that would operate within CDC's emergency response structure and lead all of the zoonotic aspects of the spread, meaning anything that had to do with the virus transmitting between people and animals. And so here were our priorities. And as you can see, we not only wanted to gather evidence to determine the zoonotic nature of SARS-CoV-2, but we wanted to make sure that the entire US government was coordinated, was speaking the same language to the public. And that involved obviously a lot of coordination and strategy in releasing joint guidance, in addition to those joint investigations for SARS-CoV-2 events that affected both people and animals. And you might be wondering, with the human pandemic and how it went and how large the human pandemic actually was, why we would care about animals with SARS-CoV-2. Well, the reason for that is because we now know that SARS-CoV-2 has actually a really broad mammalian host range. So we've discovered the virus in cats and dogs, lions, gorillas, hippopotamus, a very wide range of mammalian species. So we wanted to understand if those types of transmission events could lead to reservoir establishment and transmission within new populations that could then spill back into people. So in addition to that, we wanted to create and produce evidence-based guidance that would best protect not only people, but the health of animals as well. So what we did was we actually broke down our strategy into these 4 different groups of animals where we saw SARS-CoV-2 events actually occurring. So the first is companion animals. So these are really like dogs, cats, hamsters, etc., living in people's households or those same animals in animal shelters. The next interface we examined are zoos, sanctuaries, and aquaria. And I can say, I don't think we expected this particular interface at the beginning of the pandemic, but we noticed actually a lot of exotic animals being infected with SARS-CoV-2. And actually the best information we have about the host range of the virus came from these types of infections. We also studied farmed mink, which seemed very particularly susceptible to the virus, and then free-ranging wildlife. And I won't talk in too much detail about each of these demographics, but what I do want to talk about is what we know now. So in terms of exposure, what we have seen overwhelmingly in probably 90% of investigations is that animals are infected after they're in close contact with the person that has COVID-19. That's probably not that surprising, but it was nice to actually be able to provide that type of information. We also know that in some cases, the virus spreads between animals in a population. So in natural settings, we've seen SARS-CoV-2 spread between animals for mink, in zoos and aquaria, in wildlife. And we think it's probably happening in households, but it's a little difficult to detect at that interface. We also have seen experimental transmission of the virus under controlled laboratory settings in a number of species, including cats, ferrets, hamsters, deer, and others. And then perhaps the thing we were most interested in from a public health standpoint is animal transmission back to people. And we've seen that in a few different interfaces as well. So on mink farms, white-tailed deer, lions, hamsters, and cats are our current examples of spill back. So with all of this information, it really, this is a big summary of almost 2.5, 3 years of work, but we've put out recommendations where we're basically saying that overall the risk of contracting COVID-19 from an animal is quite low, but you can give COVID-19 to animals. So treating animals kind of like you would treat other people when you're sick is helpful for just preventing those types of introductions into animal populations. And so with that, I wanted to talk a little bit more about one particular interface, which is free-ranging wildlife, and in particular, white-tailed deer. They have been kind of the most of our activities for the last 1.5 years. The reason being because it's the first wild population of animals that we've actually seen infected, and they're very capable of spreading infection. So I wanted to just take a little bit of time and talk to you about what we know so far in terms of the exposure, transmission, as well as spillback. So for the first time, we were able to detect serologic positive white-tailed deer in early 2021. We've also found serologic positive captive deer at some facilities in Texas, although we've never found PCR positive captive deer. After this initial detection in mid-2021, there followed a number of papers actually that found antigenic detection in free-ranging deer. So this would be the equivalent of like a human PCR test detecting it. Since that time, we've also found that mule deer have also been found positive for SARS-CoV-2 in at least 3 US states, Nebraska, Utah, and California. The interesting thing is that despite having this kind of widespread transmission in white-tailed deer, we still do not know how these deer are becoming exposed to SARS-CoV-2 in the first place. Of course, there's some strong hypotheses for how, and those include direct contact, like individuals that hand feed deer that come to their yards, deer that are being rehabilitated and released back to the wild, managed deer that might be baited to certain sites for culling. Those are all probably very likely hypotheses for how deer are becoming infected. Other possible hypotheses are indirect contact through fomites, which might be in garbage facilities or wastewater, although we've never found infectious virus present in wastewater. Or it could be that there's an unknown reservoir in wild populations already that we just don't know about, or potentially rodents. So those are all kind of hypotheses for how these deer are becoming infected in the first place. But regardless of how they're becoming infected, what we know is that they can transmit the virus quite effectively within their populations. And there's many studies now that show this. So there's some experimental challenge studies that show transmission between an infected white-tailed deer fawn and an uninfected one housed nearby. And we've also seen natural transmission events identified in several different studies, including a few of the ones that I am showing figures of here. All of these support that the deer seem to be able to transmit and maintain infection within their populations, at least for some period of time. So this is kind of what we know to date in terms of where we've detected white-tailed deer or mule deer that are positive. So the states in blue are white-tailed deer detections. The states in I guess teal are both mule deer and white-tailed deer, and green are just mule deer. And the interesting thing is this is almost the entire range for white-tailed deer shown in blue. So it seems like they've been infected probably at multiple different times throughout their range. And the last thing I wanted to share was a new study that just recently came out. So as a result of these kind of findings that white-tailed deer throughout the US seem to be infected with SARS-CoV-2, in 2021, USDA began a nationwide surveillance program to essentially find and detect SARS-CoV-2 in wild white-tailed deer. And they did this by leveraging actually an existing surveillance program for chronic wasting disease. So in many states, hunters are required to submit the heads of their take to wildlife authorities to test for chronic wasting. And so USDA was able to partner with these wildlife authorities to sample the heads for SARS-CoV-2. And so what I'm showing you here are some of the genomic results that came from this nationwide surveillance. So over 8,000 samples were collected from white-tailed deer throughout the US during the hunting season that occurred from November 2021 to April 2022. Overall, about 13% of deer were positive for SARS-CoV-2. And we were able to obtain sequence from around 400 animals. So the figure on the left is showing the variant that the deer were infected with. So in this red rectangle here, those are the variants that the deer were infected with. So alpha, gamma, delta, and omicron. And on the top is the predominant variant in the human population at the same time. So what you can see is, even though alpha had fizzled out in the human population, we were still finding it in deer. Similarly, delta was fading out in early 2021 in the human population, still finding it in deer, which really suggests that these populations are able to maintain variants of SARS-CoV-2 that have mostly gone extinct in the human population. On the right, what I'm showing is a phylogenetic tree, and we color-coded it to show clusters. So green are clusters that we knew to expect. So these are situations where humans transmitted the virus to deer. Blue are clusters where there's indication that humans transmitted the virus to deer, but then deer transmitted the virus to other deer. And then red were the situations we were hoping not to find, which is humans transmitted the virus to deer, and then a deer potentially transmitted a virus back to people, which is certainly a public health concern. But unfortunately, we've actually seen the transmission of SARS-CoV-2 from deer back to people before. So in 2022, a paper was published that describes the likely transmission of a very divergent virus, first discovered in deer, to a person with that same divergent virus that was subsequently identified to have previous contact with deer because they were a hunter. So this really highlights that hunters in particular are a population at risk. But our ability to detect these type of events is quite limited because we do not have strong surveillance in wildlife populations. Human sequencing is getting a bit more challenging as the end of the public health emergency has been declared. And we have to have enough epidemiologic information to link infected wild animals with a person, which can be quite a challenge when the virus really only sticks around for about a week or two in either a person or an animal. But I wanted to just summarize some of our overall public health concerns and implications with the white-tailed deer story that I've been talking about for a little while. So the concerns we're really concerned about are the establishment of a North American reservoir, transmission between wildlife species to other animals, such as other wildlife or domestic species, and then recombination of this SARS-CoV-2 virus in a wildlife host that has another coronavirus, because we know these coronaviruses are prone to recombine. And the reason overall that we're concerned about these events is because these types of viruses could emerge with mutations, strains or variants that can infect people from wildlife. And we don't want to have a situation where those new variants might evade our therapeutics, our diagnostics, or our vaccines. So resulting from all of this information, we have put out guidance that used a One Health approach. So this guidance is endorsed by the USDA and DOI as well, but it is on our COVID website. And it's called Reducing the Risk of SARS-CoV-2 Spreading Between People and Wildlife. So the very last thing I wanted to just briefly touch on today was resources that we have freely available for use whenever they might come in handy for you, and how we can kind of stay in touch after this webinar. So since I've been talking about COVID-19, I'll just stay there for one more moment. So we do have a number of resources specific to the zoonotic transmission of SARS-CoV-2. And perhaps the most relevant is the one I was just talking about here. So this one gives guidance for members of the public, including hunters, wildlife managers, and wildlife rehabilitators on how to kind of reduce that risk of spreading SARS-CoV-2 to wildlife or potentially contracting SARS-CoV-2 from wildlife as well. We also have a number of more generalized resources, and we're really trying to continue to build our library of One Health communication resources, including handouts, social media graphics, and videos. And if you ever have a One Health in action story, like the one we're showcasing on that right-hand panel there, we'd always love to hear from you actually. So we actually will promote via our One Health networks and support any sort of social media dissemination for those. So if you ever have a story that fits these One Health in action, we'd always love to receive it. I mentioned earlier as well that we work on emergency response, especially for environmental events. And we actually did put together these disaster preparedness education materials that can help people, especially in this hurricane season, kind of get a little bit better prepared for their pets to ensure that they're ready for emergencies as well. And then finally, we have a number of education resources for our youth, just recognizing how important our next generation is for promoting One Health and the health of people and animals as well. So we're showing a few of these here. All of these resources are available on CDC's One Health webpage, which I will show you the link for here. And then finally, there's a couple ways to subscribe to our newsletter. We've got two actually, the One Health newsletter and then the Healthy Pets, Healthy People. And we also hold a call called the Zoonoses and One Health Updates call. We hold it once a month on Wednesdays, and we're always looking for topics. If you do have a One Health story you want to tell, but we also offer continuing education through that call if that's ever of interest for you to tune in. And then if you ever want to reach us, please feel free to at onehealth@cdc.gov. So that's all I have for you today, but I'm very happy to take questions and have a discussion about anything I've talked about so far. Thank you.
Yes, thank you.